Dr. Jaffe, can you help us understand why you've chosen the particular sweeteners in the PERQUE products, namely mannitol, sucanat, and whole cane juice? And also, if you could comment on monk fruit as a sweetener, and why or why not, why it wouldn't be a good idea to use.
Well, let me take the second part first and then get back to the first part. Monk fruit. Monk fruit is a food. It has a very unusual effect on your tongue, and it prevents bitter tastes from getting to your taste buds. And for several hours after you get enough monk fruit, most everything is going to be sweet. And so this was developed clinically, commercially, medically, for people who had advanced cancers and had trouble eating. Because the thought was, gee, if the food tastes a little sweeter, maybe people will take more in, have more appetite. It turned out that monk fruit alters the brain chemistry and alters it enough that the FDA has stopped all studies of monk fruit. You can use monk fruit in supplements, and we do use a little bit of it some of the time, but a physiologic amount. And the reason, going back to the first part of your question, the reason we specify organic whole cane sugar juice, which Sucanat is. Sucanat was the first branded version of organic cane juice where everything, including the molasses factors, were retained and where it was produced on the farm. So fresh cane juice has been shown in Switzerland to be health promoting, especially for the gums. This was a dentist who happened to be Victor Begin's uncle, who studied 2 valleys, one of which had people who ate standard empty calorie sugar, and the other where people were willing to take this organic evaporated cane juice. And the differences were really quite substantial. One little footnote is this would have been in the early 1990s. We were asked to test whether the blood sugar and insulin changes associated with, say, 50 grams of sugar or 50 grams of fructose or 50 grams of empty calorie typical sugar, how did that compare with organic evaporated cane juice? And we only did, if I remember, 4 or 5 people, but the results were quite consistent. Organic evaporated cane juice is metabolized like a whole food because it has the cofactors, the things that are in the molasses that are removed from almost all other sugars. Now notice I didn't mention mannitol. Mannitol is a non-caloric sugar. And we know a lot about mannitol because, for example, if your brain was swelling, your doctor might give the right kind of mannitol to pull the fluid out of your brain at just the right rate. So there are a few sugars that are available in highly refined and pure form that are non-caloric and that help with the uptake of certain nutrients. And we use it that way, physiology before pharmacology. So I think that addresses the question. These are whole foods that contain sugar, but with the cofactors that metabolize them. And therefore, it's like having a root vegetable, you know, at least by analogy. So we exclude empty calorie and or contaminated sweeteners. We use those that are whole foods, safer, healthier, and usually providing multiple benefits in terms of uptake of other nutrients facilitated by the components in the organic evaporated cane juice, sucanat, etc. So, good question. Glad that you will be able to explain to people the difference by design and feel the difference by design in the PERQUE products compared to almost everybody else. Because the industry, of course, uses lots of binders, fillers, lubricating agents, slowing agents. They throw fructose and corn into almost everything. And it's possible, but it's challenging to get behind all of the details that you need to understand not just the molecule, whether it's mannitol or organic cane juice, but that specific source of that specific molecule and what else is there. So we want to use whole constituents. I understand that many people believe that any sugar is bad, and I do often say that people are sweet enough as they are. They don't need added sugar in their diet. But we do want to call attention to the health benefits of organic evaporated cane juice and pharmaceutical grade mannitol.